Hello, everybody, and welcome. I'm really pleased to be a part of People and Planet United. It's a global health and purpose summit, a global gathering bringing together leaders across health, technology, and innovation to explore how we could drive better outcomes for both people and the planet. And today's conversation, which I'm really excited about, focuses on one of the most important and rapidly evolving areas in healthcare, AI governance and the future of responsible care. My name is Ivan Ruiz. I'm a partner at Fin Partners, where I work at the intersection of health, innovation, and communications, and I help organizations navigate complex transformations and emerging technologies, finding ways to help them engage with their stakeholders in the newest and most innovative ways. And of course, AI is at the top of that list right now. So to say that I'm very much looking forward to today's discussion would be a complete understatement. I'm delighted to be joined by Dr. Theodoros Zanos. Theo's the head of the Division of Health and of Health AI at Northwell Health, where he leads efforts to develop and implement AI-driven solutions across clinical care. His work sits at the intersection of neuroscience, engineering, and artificial intelligence, with a strong focus on translating innovation into real-world clinical impact. He's deeply involved in shaping how AI is responsibly integrated into healthcare systems, not just from a technical standpoint, but from a clinical, operational, and ethical perspective. Theo, I'm so happy to have you sitting here with us.
Thank you, Ivan. Great to see you, and yeah, looking forward to this discussion.
Amazing. So if you're cool with it, we're going to jump right in.
Yeah.
To start us off, I'd love to come up to 30,000 feet so we can take a look at the broader landscape. Beyond consumer and HCP adoption of Gen AI or conversational AI, because for many people, like that's really what their understanding of AI is and where it starts. Um, you know, how do you see healthcare being reshaped by AI?
Yeah, so AI is quickly being adopted in healthcare. Healthcare was one of the last, let's say, fields that have has been adopting any technology really because the stakes are a lot different when it comes to healthcare and delivering care for patients. But it's here, and it really is transforming a lot of the ways that we are caring for our patients. I see mainly three fundamental shifts. The switch from the reactive approach of delivering care to the more anticipatory approach. Uh, we also, I think, through AI, we can move from a more intuition-driven framework to a more data-based and augmented reasoning. And then finally, I think that with all the different data that we start collecting and now making a lot more sense through AI. We're moving from kind of like episodic snapshots to a more continuous, more holistic understanding of the status of a patient. Um, and all of these are essentially different operating models for medicine. And that's why I think these are fundamental shifts in the way we practice medicine, and they are heavily enabled by these AI technologies. Um, right now, the most visible change that we see is not necessarily clinical, but it's more administrative.
Mm.
You have ambient scribes, you have prior authorization, automation, documentation assistance. That's where we see AI delivering a lot of immediate productivity gains, and also some clinician relief. Um, the clinical transformation kind of lags. It's slower, but it's coming, and that's mainly because we now have clinical decision support tools that are powered by AI that are finally start to work at scale as well. So they are able to take in all the data that we commonly measure in our patients, demographics, labs, vitals, all those types of data. But they also start incorporating medical notes, which was harder in prior years to incorporate, and that creates more and better solutions that work at scale. So we can deteriorate, we can identify patients that deteriorate, we can predict sepsis, we can try to identify people that are likely to show up again, so readmissions, no-shows, mortality models. So there are a lot of tools to help us identify really high-risk patients, and that provides an augmented ability for our clinicians to care and risk stratify these patients accordingly. So I think that's the closest to a really to a genuine transformation that I see in the clinical workflow today. That's here and it's expanding more and more. Um, in terms of the additional data that we have for all the different patients, um, I think that, all the data that we have from wearables, from ambient sensing, from voice or oculomics, or there's all kinds of very exciting fields inside health AI that are providing more and more opportunities to have a more holistic view of a patient and really, provide care that is anticipatory, so preventing rather than just reacting to somebody just getting sick. So there's a lot of opportunities there that are coming to play. And also, I think a big thing that's changing is the role of a clinician and the nurse. Um, with the advent of EHRs, a lot of the clinicians have been data gatherers, frankly, on top of actually uh, caring for patients, of course. So they've been tasked to put in like the information for each of the patient into the electronic health record. But now that role is slightly shifting, where we're enabling that to be a bit more seamless, the data gathering, and we're focusing a bit more on like the helping them to interpret this vast amount of data. So that the role shift from data gatherer to data interpreter to me also seems like a fundamental shift in the way that they're going to be performing their work. Um, but and I'm just going to wrap up my answer by saying
Yeah.
that most health systems um, are looking to start using these tools, but by no means this is everywhere and in every single thing that we do in clinical medicine. So there's still a lot of work to be done. We're still kind of like more at the demonstration phase rather than the transformation phase. I think the next 3 to 5 years are going to be very important for the field because on top of actually making the tools deliver their promise, what we also want to make sure is that we get it right and we don't repeat some of the mistakes that we saw in the electronic health record advent and the story there, which we don't want to create a technology that promises liberation from all the mundane tasks of practicing medicine, and what we deliver is essentially burnout. So I think that's where we really need to focus on a lot.
Yeah, that makes a lot of sense. And I mean, it feels like the next 3 to 5 days are going to be a lot of 3 to 5 years, sorry, are going to be a lot of trial and error as well. And with that comes um, the development of governance, guidelines, guardrails. I mean, when I first started in digital marketing and communications, you know, the health sector had just started to embrace social media and digital marketing. And we spent half of our time developing guidelines and defining these guardrails so that everybody could embrace these new channels but remain compliant, right? And protect users and all of those things that are bubbling up again now with AI in the picture. So, I mean, you just talked about so many different use cases, and I would imagine that they all carry different risks, require different types of evaluations, different types of frameworks. So, you know, what does responsible AI governance actually look like in a health system?
Yeah, I mean, in healthcare, we're a tough crowd. We
Yeah,
kind of like not necessarily adopt all the new trends and technologies immediately, and that's for a good reason. As I mentioned before,
yeah.
the risk profile is completely different than a lot of other industries. I'll tell you that in general, AI governance is at the center of a responsible strategy to use these tools, and it's not just a buzzword. AI governance is a set of principles and processes that a health system needs to use not only to remain compliant or to do well for their patients, but also to utilize at its fullest the capabilities of these technologies. So the first thing I would say about a responsible AI governance framework is, and a lot of people kind of like skip this, is
Mm.
to take stock of what you already have. So really start with an honest inventory of all the AI tools or clinical decision support tools that you have, because all of these kind of like touch on similar themes. Most health systems, and especially large health systems, have grandfathered a lot of these processes and some AI tools that might exist before any governance structure that you have if you just started, right? So, there could be tools that are baked into old vendor contracts. And it's really important to identify in large health systems who uses what and how,
Yeah.
because, of course, you can't govern what you have not cataloged and know that it's there. So that's kind of like the very first step. And parallel to that, and especially lately, um, you also need to make sure that you tackle what we call the shadow AI problem. And that came about from the fact that consumer AI, like all these AI chatbots that were made available end of 2022, became tools that clinicians, nurses, healthcare providers started using on the side.
Yeah.
And of course, using consumer chatbots with patient health information is a big no-no, is a data exfiltration event. So really, you know, and these are things that we kind of know exist across the industry. You have providers pasting discharge summaries into a public LLM, and that is actually a security incident. So whether people call for it or not, it actually is important to acknowledge that this is happening, and blocking off these chatbots from your network won't solve the problem, because people have personal devices and they trying to hack and create these productivity hacks. But what they essentially are doing is creating HIPAA incidents, waiting for a press
Sure.
release, really.
Yeah.
Um, so it's really important to identify the problem, and there are solutions. I mean, at Northwell, we've created an internal AI hub where like all these LLMs are available for administrative or like other productivity use cases for our clinicians, without the risk of the data leaking out to non-HIPAA compliant servers. Um, but at the same time, the way that we're building AI is we're trying to figure out what are really the needs of our stakeholders, which are the clinicians and the nurses. So it's really identifying real problems that AI can use, and not ask whether they like or a tool after the model is actually bought, or like the contract is signed or a model is built, but really before we even consider a solution, right? It's important to, in this AI governance framework, to start asking questions to the stakeholders super early on, right? Is this solving a problem that they actually care, recognize? Um, and is this going to be used? Do they like how it looks, the tool? Do they understand how to use it? Does it fit in their workflow? These are important things that you should do before you even consider like, imposing like the next steps of AI governance. Um, the next steps, of course, as if all these boxes are checked, you need to really validate your tools and validate them honestly. And when I say honestly, it's validate not only how accurate they are, but also what is the true cost of using and deploying these tools. Usually the contract or the license fee is almost the smallest line item in like deploying an AI solution in healthcare. You have integration efforts, training of the staff, monitoring infrastructure that needs to be set up, and ongoing support for all these tools. And all of these
Mhm.
are heavy lifts, not only for the company that brings in the tool, but also for the health system itself to put in the right people behind IT, behind enterprise digital, all these different people that will need to work on making sure that this tool works right in the health system. So it's important to take that into account in your decision on whether you're deploying a tool and how much it will actually cost. And then, as soon as you go through all of these and you know that the tool is the right one, there are all these different pilots that we usually use, right? So you don't go full scale across 28 hospitals as it is with Northwell, but you start off locally in a controlled environment where you're trying to see how this would work. And a lot of the times uh, uh, we're focusing on things that are almost, guaranteed wins, mostly because we don't want to necessarily test our assumptions, but we just want to celebrate using these tools. So it's important to also be honest in testing the right things when you're piloting these tools. Because all of these are going to come back to haunt you after you scale up across
Right.
all the hospitals, right? And then the last one, and I'm just going to wrap up. Sorry, but it's a lot of different steps in the AI governance that need to be taken into account. Is once the tool goes live, that the AI governance doesn't stop and it moves on to the next tool. Of course, it needs to go to the next tool, but also it needs to set up a continuous monitoring framework where you're monitoring the tool and how it works, because we know these models do shift in their performance across time. And
Mhm.
also, I would say the other thing that often is not necessarily thought of is that you need a named human owner for each tool, not a committee that like everybody will opine on. It's really a person. We call sometimes that person a clinical champion, but really is a person that will own each tool in that hospital and be able to not only answer questions from leadership, but also to be the bridge between the tool, the stakeholders, and leadership to actually decipher what's going on and make sure that that model is working. So a lot of different moving pieces. Try to kind of like put them like step by step, but
Yeah.
yeah, AI governance is not really a simple thing, but it's by design.
And I would imagine that along the way, like wonderful things can happen, right? Because when you give a tool to a person and they're able to use that tool, they discover different ways of utilizing that tool. And that leads, like these kind of branches of discovery that lead to other tools or the optimization of this current tool, right? Have you experienced any of that?
Yeah, absolutely. And I think that the key is when you give somebody a tool, if you give them the opportunity from the get-go to design it with you and not just
Mm,
give them and say that's it. And that's kind of like our benefit of like being in-house at Northwell. We have a direct line from the early stages of conceptualization of these models on like what would be important to you, how would you like this presented, and what are some other things that they might that come up while we're building this and that could help you, right? So that happens super early on, but as you said, even after that, people are amazing at finding new use cases for certain tools so that to help them. The only thing that I would put as a word of caution is that yes, people will find ways to like use all these tools in creative ways as long as they are trained properly and they
sure.
understand what this tool does and doesn't, and they know how it works and what its limitations. So I completely agree with you. I mean, the best person to utilize the tool at its fullest is the people that are doing this every day. They're in the front lines. That's the clinicians, that's the nurses.
Yeah, and creating that feedback loop is
Correct.
absolutely critical, which is a great transition to like, what have you learned? I mean, you're living and breathing this at Northwell Health, right? So like, what are some key points that you would want the industry to know, or key learnings that you've experienced in the last, couple of years that you've been doing this?
Yeah, so I mean, I mentioned several of these themes, but I think the main thing that we've been quite active on is, from our standpoint, validating the tools and validating the tools both in terms of their predictive, let's say, or accurate performance, but also throughout the life cycle of a tool. So usually what happens is we have an AI tool, we have some specific vendor metrics, right? Or our initial metrics when we are developing it. And that's kind of like a hypothesis. It's not really a guarantee or a fact that that's exactly how that model is going to work.
Hmm.
And we've recently published a study where we've shown that even at the with clinical decision support tools from Epic, the largest health system vendor in terms of electronic health records, um, you see that the real world performance often deviates from the vendor reported numbers. And that's pretty much a rule in our industry and not an exception, right? We know that when a model is developed, um, you train that model in a specific population.
Sure.
So when that population change or when the time advances and new things emerge, most likely that performance is going to get affected. So one of the things that we've learned is that local validation of these tools, when it comes to your population that you care for, is not an option. It's almost something that you absolutely need to do it. Otherwise, you don't know how your model works. So you should know that uh, when you take a model in and you try to use it, there should be a way to actually address its performance across your patients in your environment with your workflows and your data. Um, and that's, of course, an expensive process. It's slow, but unfortunately, in my mind, it's non-negotiable if you want to know how this technology actually works at your setting.
Yeah, I mean, it
Um,
goes back to what you said earlier about creating these pilot programs, right? You can't like launch at scale. You need to create another controlled environment beyond the one where they created the tool
Correct.
and then
And
test
it's
from there.
And it's even before that, right? So, like before you even launch into a pilot or a test deployment, you should know, and there are ways to actually know, take that tool and run it in retrospectively, like for the past 2 years, how would it perform, right? So there are ways to actually figure these out and make sure that that at least you expect a certain amount of performance, and then decide whether that performance is good enough for you. Maybe it's not, and maybe you can. There are ways also to retrain these models depending on the vendor, and but I think that one thing that our work in validation and AI deployment has taught us is that validation and local validation specifically is not an option. It's absolutely something you need to do. And then to me, when it comes to the outside vendors, uh, vendors that are not necessarily they can't answer these transparency questions are not necessarily very thoughtful of their design. So
Mhm.
I think this is not a the validation part is not only a requirement from the health system, it should be an absolute a requirement from any vendor because they should be willing to provide not only the performance metrics but local performance metrics and not see this as a burden but as an opportunity to showcase that their tool actually works well.
Yeah, that makes a lot of sense. And given the speed with which organizations are adopting these technologies, I mean, I saw a stat recently. It was like 75% of US health systems now use at least one AI application. That's not hard to grasp in your mind, right? That makes a lot of sense. But at the same time, it's gone up 60% in just less than a year. Like that number
Mhm.
that's a huge number. And I would imagine that there have been a lot of stumbles along the way. Like what common mistakes do you think organizations need to keep an eye out for as they learn about new technologies, learn about these new tools, and then begin to embrace and incorporate them into their workflows?
Yeah. So you're right that like we have definitely picked up as an industry in using AI tools. I would say that most of that uptake is driven by administrative tools again,
Yeah.
but that's still like a very important part of course, the industry. I would say in terms of like let's say again, more clinically oriented health AI tools, the one mistake that I've seen happen is when we design pilots, again, we don't necessarily design to learn, but to succeed. So you're cherry picking the location. It's a very friendly site. You find your clinical champion that's involved, and they are early adopters. You have intensive coaching on that site, and then you kind of like define also a specific metric that can only go up. So you haven't really learned anything from that. That's a pilot that cannot fail in any way because you've structured it this way is a marketing exercise, is a demonstration. It's not really teaching you things. So you have the pilot succeeds, you have press releases going out, but really the tool starts failing the moment it starts scaling across all hospitals, right? So real pilots to me have to have baked in failure conditions, have to test those out and really identify, are we willing to take those types of risks? And I understand that a lot of times we want to make sure that like pilot succeeds because that leads to a contract most of the times. But at the same time, maybe you want to expose all their failure modes and really address them. I would like to see a bit more of that. So, like designing a bit more around this. The second mistake I see happening is that when AI is not necessarily adopted the way we want it, we're blaming the stakeholders, the clinicians, the nurses. We say the doctor didn't trust it, the nurse didn't respond, they weren't trained properly, they're resistant to change. I think that's a bit of a lazy attitude. I think a lot of the resistance to these tools stems from a very real problem, which is what we call alert fatigue. When you have tool that flags the same patient 50 times and nothing's really wrong with the patient, that's a system design failure. The fact that the user stops responding and doesn't pay attention to this AI tool is not a user failure, it's a tool failure, right? So it actually is frankly a rational behavior. It's not a character flaw of like the users. So I think there needs to be a consideration for that, very heavy consideration, especially for all these alerting AI tools, to make sure that you're not going to impose more fatigue and have the doctors not use it. And then the last mistake I see is that performance metrics, when it comes to accuracy and all that, these are important, but they don't capture the system impact of using these AI tools. And what I
Mm.
mean by that is at the end of the day, what we really care about as a health care system is the well-being of our patients. So it's, mortality, the hard outcomes, as we call, lengths of stay, mortality, deteriorations, uh, all these different things that a lot of the times model that are trying to address, they don't necessarily measure in these pilots. So we see, okay, was it accurate? Yes, it's accurate, but did it move the needle on all these different outcomes?
Right.
And a lot of the times the answer is no, not because the tool is not correct, but because we haven't optimized the motor part of the process. We have the sensory part down, right? We have this AI tool that flags the patient, identifies the patient, and says this patient is likely to deteriorate. Okay, what do we do after that? Where do you surface it? And do the people that use it have the authority, the trust, the training, and knowledge to actually act on what the AI tool tells them to do, right? And that part is often neglected, and a lot of the times that comes back to hurt you because if you don't move the needle in the real outcomes, nobody's going to care that your AI model was 99% accurate, right? We used it and nothing moved, right? So a lot of the times the focus on on that motor is neglected, then I think that's an important mistake to avoid.
Yeah, and I mentioned opening that feedback loop with the users, but I also think it's important to open the feedback loop with the tool itself, right? Make sure that we're feeding back into it key learnings that we're experiencing, because I think that's how it learns and that's how it, begins to adapt to the workflows that we're requesting of it. I mean, it's a great transition because the things that you just talked about are really more about the clinical realities of using these tools. And I read, again, like the AMA posted a survey readout recently, 66% of US physicians use AI tools daily. And that increased again 80% since last year. Like that's huge adoption.
Yeah.
So you talked a little bit about building trust and ensuring that these clinicians build trust, but like how do we ensure that these tools are supporting clinicians rather than creating more work?
Yeah. So the very first thing, and I completely agree with you. Again, really, the main driver of AI tools from clinicians has been chatbots, right? And most likely, a lot of them have used it in their personal lives, in their everyday lives,
Mhm.
asking things or conversing with the bot. And then they realize that this could very well help me a lot in like a lot of the things that I don't necessarily want to do or spend time, the whole pajama time, the idea of like writing notes after you go back home. Uh, so I completely agree that like there is a big uptake, but there's still a lot of work to be done to make sure that these tools, actually support them and not just add more friction. And I mentioned alert fatigue. I think that's like a very
Yeah.
important problem, right? That we always need to keep into account. We kind of like want to treat the clinician's attention as a finite resource because it is, right? Every time that we call on a nurse or a doctor and it's a false positive, essentially, that erodes, well, it wastes their time, but it also erodes trust. So it's how do you deliver these alerts without burning down this what we call a cognitive budget that the clinicians have, right? So that question is extremely important in ensuring that they keep on using it and they find value in this tool, right? Um, and often, a lot of the times, we think that, um, oh, they don't use it because they don't necessarily understand that tool.
Mm.
So there has been a big focus on the field on explainability, right? How can we make these models more transparent? And I think it's an important thing to consider, but at the same time, I kind of feel like that obsession with explainability has also been a misdirection. And I'll tell you why. And I know this is a bit controversial, but the right now most of the AI tools that clinicians use are chatbots, are large language models. Large language models are most likely the most opaque AI models we've ever created in the history of AI, right? We don't know the data that they've been trained on. We don't understand, not the people that have built understand the internal architecture of them because they're so complicated and so massive. And also, when they produce certain responses, we don't necessarily understand why. And a lot of the times they go off in tangents or they have like all these different interesting behaviors that emerge that we didn't even expect, even the people that built it, right? So we have like the most opaque models being the most used, mostly because they're not explainable, but they are useful, right? And most of the times they're accurate or they sound accurate. So they're very confident in their responses.
Yeah.
So what I would say is that, we got to maintain trust in clinicians to use these AI tools because that trust is easy to miss, is easy to lose, right? And it's that trust is built both from explaining why you're saying a certain thing to the clinician, but at the same time, really, it's important to make sure that you are accurate when you say something's happening. Because as soon as you start making more and more mistakes, then that trust erodes. And that's because clinicians use a lot of tools that they don't understand at the very extreme basic level. They don't necessarily, all the clinicians that see a CT scan, for instance, they don't necessarily have to understand the underlying technology of what a CT scan uses, right, to create the image. But they see the image and they interpret it and they act accordingly. The same goes with the eye. As long as the AI tool provides a trustworthy answer, they will use the tool even if they don't understand exactly the mathematical reasoning behind it, mostly because it's useful to them and it's reliable, right? So that's kind of like how you really build support from clinicians, I think.
Yeah, I mean, we conducted a small sort of survey among some of the HCPs that we regularly work with and engage and consult with, to see what their adoption of platforms like Open Evidence is like, and it was unanimous. Not only them, but their immediate network of physician friends are all gravitating toward that because they know what's feeding it, right? Like that
Mhm.
trust is there. It's
Yeah,
being fed by peer-reviewed journals. It's a closed environment. I don't know how HIPAA compliant it is in terms of
it's
like
not.
copying and pasting
Not
information. And I
yet,
don't
at
think that
least.
that's a great idea.
Yeah.
But it is really interesting to see how it has become an infused part of their workflow. I mean, it's
Mhm. Yeah, no, and these the array of tools are going to keep increasing, right? Because healthcare is a domain that's ripe for disruption, and there's a lot of places that we could be using tools to ease up and optimize processes. But again, the it's a it's a process that needs to be done very, very carefully.
Yeah. And to that end, I mean, I feel like we're shaping this landscape as we speak. This conversation
Absolutely.
in many ways is hopefully helping to shape that landscape. So I'm curious to know, with so many stakeholders involved, health systems, the tech companies that are creating the technologies, the regulators out there that are saying yay or nay, like what role do each of these folks play in like setting the standards for the industry and like defining what this new landscape and new reality could possibly be?
Yeah, and I think you've identified the three main players in this field, right? You have the health systems, you have the tech companies, and then you have the regulators, right? And I kind of think of them as like three legs of one stool. Like if one goes out, most likely the whole thing falls apart. I
Yep.
do think, though, that although let's say, the role, the responsibility is distributed, it's not evenly distributed. And I'm going to explain what I mean. Um, I think health systems carry the heaviest weight in this responsibility, right? A lot of the times we hear that, well, the health system is the only part of the three players that has the direct contact and relationship to the patient.
Yep.
So the health system buy these tools or develop them in-house, right? They deploy them, they integrate them into the clinical workflow. So they are the responsible part in how this works. So they can't necessarily hide behind like a vendor or behind like a regulator. At the end of the day, they will bear the consequences, positive or negative, of using this tool on their patients. So I think they're that's kind of like the role of the health systems. For tech companies, um, I understand, and I'm an engineer by training, so I know very well how the tech industry works. I know it's really important to move fast, but in healthcare you cannot break things. So, and the way to do this is to increase as much as possible the efforts for transparency, and that's not, again, explainability. Transparency is all about giving details about the population, the data that they were used on, that was used to train these models, right? Where do they take their information from? Uh, Performance metrics that are, I think, very important, and how these stratify across different populations and different cohorts, right? What are the known failure modes, at least the known failure modes that they've experienced in like past deployments, right? Uh, good vendors I see always are ahead of this and always do this. Um, and a lot of the times, what we're asking is not getting exposing their IP. There's nothing that proprietary about this information, right? It's all about reporting honestly and not hiding behind like cherry-picked numbers. Um, the regulators, I think, also have a very hard job. And the problem with that is, the FDA and other regulators like this are have a very hard time keeping up with all the different changes. The existing frameworks that we have are for mainly static products, right? Whether it's med devices or drugs, they don't evolve as fast and as much as AI technologies. So there are thoughts about market surveillance, post-market surveillance, and all these different tools, but all of these are, I think, just need to step up in their speed because right now the pace is too slow. And as you mentioned, the industry is taking up these tools and using them, and there needs to be a regulatory body that doesn't stifle innovation, but keeps things in check because it can't be that only the health systems bear the burden of doing everything, right? Of like using these tools and also validating them and also regulating them. I mean, we're moving towards there, fortunately or unfortunately, because the regulators cannot keep up necessarily. But at the same time, if that happens, then the health systems are going to start saying, why am I bearing all this heavy burden without anyone else like helping me out, right? So I think it is important for both tech companies and the regulators to start helping the health systems do this right and helping them deploy this technology safely.
Yeah, I love the word you used, static. Like the regulators are used to engaging with static environments or static experiences. I mean, something as simple as an FAQ, is kind of going out of style. We're so used to receiving conversational answers and not a link to a resource that we're going to have to rethink the way that we do that. And from a regulatory and compliance component, from somebody who creates content and has to get it, approved, and they're not comfortable at all
Yeah.
with
Yeah.
that user experience. And so that's part of the journey, right? Is getting them comfortable, building the trust, helping them understand. So yeah, very interesting.
Yeah, and I think to your point, right, something that touches directly the patients is another very important part that like almost increases the risk profile of a
Sure.
specific tool, right, or application. Because, we have for tools that are directed to healthcare providers like clinicians or nurses, that we always say that like use your clinical judgment first, augment it with the use of AI and all these different tools. But at the end of the day, you are making that decision of how to treat the patient or diagnose them, right? Now, as soon as you start, deploying these tools that directly talk to patients, right? That's a whole different barrier that you need to also uh, uh, cross, right? So it's there's so many different use cases that all of these potential issues and opportunities arise. But I think in general, the mindset of trying to make sure that everyone chips in this and feels responsible in developing a safe product that's also innovative. I think that's the winning formula because if it's all put on the health systems, it's not going to work. Tech companies by themselves cannot do it anyway, and regulators are trying to keep up, right? So we all need to work together on this.
Yeah. Yeah, it takes a village, right? Especially in a situation like this. So, final question. Like what do you think will differentiate organizations that successfully implement AI from those that are struggling? Like how are we gonna weed those out?
Yeah. Yeah, I mean, in general, as we mentioned before, you know, AI, I think, is not necessarily only an IT project in healthcare. It's really a clinical capability, and that's how you should frame it as, right? Um, Patient outcomes, which is what really we need to focus on, uh, cannot become a footnote, especially when something is treated as something that lives only in IT, managed by as a pure IT project. Uh, it really needs to involve leadership across all the different areas in a health system. So you want to have that clinician involvement from the get-go. So health systems and organizations that involve the stakeholders as early as possible are the ones that most likely will separate themselves from the ones that are just dump it into one specific part of their organization and say it's on you to do this, right? um, I also think that a lot of the times I kind of like sometimes I tell the team and my students as well that there's always money in the banana stand, and that reminds me of like one of my favorite TV shows. It's a quote from there, but also it mirrors the fact that there are a lot of boring, seemingly boring problems that we solve in health AI that are not super sexy applications. We're not curing necessarily cancer immediately, but they have tremendous both impact in clinical outcomes and also in return on investment, right? So there are a lot of like really small wins that could be leveraged so you can build on that momentum and start building more on these technologies, and also really investing in kind of like boring infrastructure, whether that's real-time pipelines, dashboards, monitoring dashboards, version control of your systems. All of these boring things are essential in the way that we're deploying this technology. So you want you want to have this in place, even if you can't have a press release about these. But it's important to deploy AI, safe AI at scale. And then we talked about AI governance. I think that's super important. I mean, I don't think there is a health system right now that doesn't have some governance around their AI deployment, but I think designing that properly will make the difference on how successful you will be when you're tasked to deploy these technologies. And one last thing, I guess, you also should think about not only taking in solutions, but also decommissioning solutions. Don't be afraid to actually intentionally and willingly decommission solutions that are either it was a struggle to deploy them or they stopped working. The death by 1,000 pilots is a
Yeah,
common phrase that you should be careful and avoid if necessary. Focus on, a few tried and tested solutions, a few pilots that will really drive your outcomes and give your best in making these tools work.
that's great. Theo, this has been a fascinating discussion. I could do this for another hour and a half if you had the time to do it. And really, really appreciative. What's clear to me is that, AI in healthcare, it's not just about the technology. The devil's in the details. It's about how we implement it responsibly, thoughtfully, and with the end users in mind, not just the clinicians and the administrative staff at the hospital systems, but also the patients, right? Making sure that at the end of the day, we're, meeting their needs and doing what's best for them. So thank you so much for taking the time. Really, really appreciate having you and looking forward to the next one.
Thank
Thank you all
you.
for joining us.